Assalamu alaikum. Am I audible to you?
Yes, sir.
Sir.
Should we start? 103 people have joined. So let us start. Assalamu alaikum, everybody. So today we are going to discuss coronary arteries. In fact, it is a revision class which I have already delivered through YouTube. So the learning objectives for today's class are: as medical students, you should know the definition of coronary arteries, nomenclature of the coronary arteries, why they are named coronaries, characteristics of coronary arteries, that is how these arteries differ from other arteries of the body, branches of the coronaries. As you know, there are two main coronaries, that is right and left. Then we should know their branching pattern, because this branching pattern is important clinically. Then coronary dominance. We will also discuss right and left dominance and also the codominance in this lecture. And some aspects of applied anatomy of the coronary artery will be also discussed in this session. By definition, coronary artery, it refers to the vessels that supply and drain the heart. The vessels which supply the heart are called coronary arteries, and the veins which drain the heart are called the caudate veins. Coronary arteries are named as such due to the way they encircle the heart, much like a crown. Crown is usually placed on the head. If we go towards the main trunks of these coronary arteries, they surround the heart like the base of the crown. And from this base, from this encircled area, ascending and descending branches arise. Ascending branches go towards the base of the heart, and descending go towards the apex of the heart. And they surround the heart like a crown. So that is why they are called coronaries. These arteries form an arterial circle which surrounds the heart in AV sulcus. AV sulcus is atrioventricular sulcus, which is also called the coronary sulcus. So main trunks of these coronaries, they lie in AV sulcus or atrioventricular sulcus. From this arterial circle, an arterial loop runs anterior and inferior interventricular grooves. In the anterior interventricular groove, there is left anterior descending coronary artery, a branch from left coronary artery, which goes towards the apex. And in the inferior, or which is also called the posterior interventricular groove, there are also branches from the coronary arteries. We will discuss in the subsequent section. Now let us go to this picture, basic picture of the coronary artery. Can you hear me?
Yes, sir.
Yes, sir.
Yes, sir.
I have kept three students unmuted. They will act as co-hosts. They will guide me if there is some problem in the presentation or in the voice. How is the voice today?
Good, sir.
Is it
Good.
better than the previous
Yes, sir.
class? That was basically the
Yes,
trial
sir.
class.
Yes, sir.
Yes, sir,
Yes,
it's
sir.
better.
So coronary artery. If we go to this section, you can see a beautiful picture of the heart. In this picture, you can also see these red lines. These are basically the two coronary arteries. So there are two main coronary arteries which supply the entire heart. What is their name? They're named as right and left coronary artery. This one is right coronary artery, and this one is the left coronary artery. Left is larger than the right one. Can you see the two branches? This is the right coronary artery, and this one is the left coronary artery. Both of them you can see on the sternocostal surface. In fact, in a dissected heart, you cannot see them because they are buried in the fat. They are present in two grooves. Right is present in atrioventricular groove, that is anterior part of the coronary sulcus. Left is also buried there, but it is branched, left anterior descending, which lies in the left anterior interventricular sulcus. They are buried under fat, so we cannot see them. But in this diagram, you can see them. So we have right coronary artery and left coronary artery. The second arrow points towards the main trunk of the left coronary artery. Now, where from they originate? In case of artery, we say that usually they are branches from. So here we say they originate from ascending aorta. In the aorta, there are aortic sinuses. By sinuses, you mean a dilatation of a vessel is called the sinuses. So above the aortic valve, we have three sinuses. They are called sinuses of Valsalva. Two of them are coronary. That means they give origin to the coronary arteries, and one is non-coronary. Coronaries, right or originates from the right aortic sinus, and the left originates from left posterior aortic sinus. Is it clear to you?
Yes, sir.
Now, this is a diagram taken from the dissection hall. You can see here this sinus on the external surface of the aorta. It appears as a dilatation and circle area. This is basically the origin of the right coronary artery from right aortic sinus. You can see the aortic sinus here. And this one is the origin of left coronary artery. This pointer is at the left coronary artery from left aortic sinus. When the heart is relaxed, the backflow of the blood fills these valve pockets, therefore allowing blood to enter the coronary arteries. So above the aortic sinuses, there are pocket-like structures because above these sinuses are basically dilatation. So what happens during diastole? These coronaries, they get filled during the diastole. Heart pumps the blood only during systole. But what happens during diastole? These aortic valves are closed. The backflow of the blood accumulates in these sinuses, and blood enters into these aortic sinuses. It accumulates there. From there, it enters into the coronaries. So right and left coronaries, they get filled during diastole, in contrast to other arteries of the body, which get filled during systole. Is it clear to you?
Yes, sir.
Now again, I will go to this term corona. You will find these terms corona radiata in embryology. That's crown-like structure. So here we are saying corona. Coronary arteries, they derived their name from the corona. So coronary arteries are named as such due to the way they encircle the heart, much like a crown. An arterial circle surrounds the heart in coronary or AV sulcus. AV is atrioventricular sulcus, which is also called the coronary sulcus. It separates atria from the ventricles, except in the region of pulmonary trunk. Here, I have made this circle. This represents the coronary sulcus or atrioventricular sulcus, which lies between the atria and ventricles. So, what lies in this sulcus? The coronary arteries, right, main trunks of right and left coronary arteries. From this arterial circle, an arterial loop runs in anterior and inferior interventricular grooves. So this one, the first one is left anterior descending artery, which is a branch of left coronary artery. It is present in the anterior interventricular sulcus or groove, and it moves towards the apex of heart. Then it enters the posterior part of interventricular sulcus, which is also called the inferior interventricular groove. So it enters the posterior part of interventricular sulcus or interventricular groove. There we have the dominant coronary artery, which is branched either from right, left, or from both. And this loop is formed anteriorly by the left anterior descending coronary artery and inferiorly or posteriorly by dominant coronary artery. So this circle and loop, they form coronary circulation. Then from this circle, we have branches, which are given both upwards, that is towards the anatomical base of the heart to supply the atria, and downwards, which are given towards the apex of the heart to supply ventricles of the heart. And in different regions, we name them differently, depending upon which region of the heart they supply. Is it clear? Yes, any confusion?
No, sir.
Oh, so you can see this. I have put there picture of coronary radiata that also surrounds like a crown, and I have placed the picture of a crown. You can compare this coronaries with the crown. You can see there we have the circle here, that is the base of the crown. From there we have these loops which surround the part. Now, what are characteristics of coronary arteries? These arteries differ from other arteries of the body. So what are the differences? Largest vasa vasorum of ascending aorta. So what is vasa vasorum? Vasa vasorum are vessels which supply a blood vessel. Heart is a modified blood vessel. So it is vessels. We name that as largest vasa vasorum arising from ascending aorta. Don't get confused. Largest vasa vasorum of ascending aorta because they originate from the ascending aorta. We consider heart as a modified blood vessel. So it is vessels, that is coronaries. They are largest vasa vasorum of our body of ascending aorta, originating from ascending aorta. They fill during diastole, as already said. Unlike other arteries of the body, they fill during diastole. So tachycardia, that means increase in heart rate, decreases the filling of the coronaries. functionally end arteries, but anatomically anastomosed with each other at arteriolar level. So functionally they are end arteries. You know end arteries which are no collaterals. They are called the anatomical end arteries. But here there are collaterals between these, but this collateral circulation does not work when there is acute MI, acute myocardial infarction, when there is acute blockage of a particular coronary artery. So we called them, though there are collaterals between the two coronaries, but at the time of the need, at the time of emergency, they don't open up usually. So we call them as functional end arteries. The only branches of ascending aorta. So these are the only branches of ascending aorta. That means under normal anatomical conditions, ascending aorta gives only two branches, that is right and left coronary arteries. We can have anomalies there, but we are not going to discuss anomalies at this level. Density of capillaries is 80 times. In case of this heart, the density of capillaries is 80 times more than the skeletal muscle. If we compare it with the skeletal muscle, because heart beats continuously throughout the life of an individual. Like other vessels of the body, they are also prone to atherosclerosis. In atherosclerosis, there is subendothelial deposit of lipids that causes to narrowing of the vessels. But they are more prone to atherosclerosis as compared to other vessels of the body. So all vessels of the body are prone to atherosclerosis, but coronaries are more prone. Now coming to the term, I have already said anatomic end arteries are vessels whose terminal branches do not anastomose with each other. For example, you can see here in this slide, you have two vessels supplying a tissue. The adjacent areas, there is no communication between the terminal branches of the two vessels. Such vessels, we call them as anatomic end arteries. If one gets blocked, there is no collateral circulation, that part gets infarcted. Infarction means cell death. In contrast, in functional end arteries, there is some degree of communication between the adjacent tissues. The blood vessels of the adjacent areas, they do have communication. We have a collateral there. But this collateral does not work at the time of emergency. So we call it as functional end artery. So though there is collateral circulation, but usually, not always, usually it does not work when there is need. So we call them as functional end arteries. With this slide, area supplied by blocked artery undergoes ischemic necrosis. Here we have anatomical end artery in this slide. You can see if one vessel gets blocked, in 100% of the cases, area supplied by this vessel gets infarcted. In case of functional end arteries, there is some degree of anastomosis between the two. But when the vessel is blocked, this anastomosis usually does not work. So the area supplied by the blocked artery undergoes ischemic necrosis. So outcome is same in both cases. So there are communications between the terminal branches of the coronary arteries, but this communication does not work when there is certain occlusion of a particular coronary artery. So now if we go to the branches of the major branches of the coronary arteries, I told you there are minor branches and major branches. Major branches, we have two main coronary arteries. One is right coronary artery, as shown in this by this arrow, arising from the right anterior aortic sinus. This right coronary artery, it is present in the coronary sulcus. But with which part of the coronary sulcus? Anterior part of the coronary sulcus, between the right atrium and ventricle. You can see this is the anterior part of the right coronary artery. Then after it reaches the right border of the heart, right margin of the heart, we call it as right marginal artery. As already said, we name these branches depending upon the region of the heart they supply. So here it supplies the right margin of the heart. So we call it as right marginal artery. Is a branch of, as the right already said, is branch from right coronary artery. Then this right, what happens to this right marginal artery? It winds around the right border of the heart, enters to the posterior part of the interventricular sulcus, then gives a branch which enters into posterior interventricular sulcus. In this case, it is the dominant coronary artery. We call it as posterior interventricular artery, and this posterior interventricular artery is the dominant coronary artery. So in this figure, you can see posterior interventricular artery is the dominant. So in this case, I'm not getting, this voice is not clear. Please unmute, except one will keep his mic unmuted so that he can give me the feedback. So this is the right coronary artery originating from right aortic sinus. From the right coronary artery, you can see a major branch in the atrioventricular groove on the sternocostal surface of the heart. Then this right marginal gives a major branch here. This right coronary gives a major branch, and we call it as right marginal artery. Then it enters into the posterior part of the atrioventricular groove, where it gives AV nodal branch, and after giving AV nodal branch, it gives posterior interventricular branch. This posterior interventricular branch is also called the descending coronary or posterior descending coronary artery. And in this case, it is the dominant coronary artery, because dominant coronary artery, we define a vessel which is present in the posterior interventricular sulcus. In this diagram, it is given by the right coronary artery. So it's a picture of right dominance. Now, this arrow demarcates the left coronary artery. Now you can see this at the beginning, this left coronary artery is in the form of a single trunk. Thereafter, it lies posterior to the pulmonary trunk. So you cannot see it on dissection table. You cannot see its origin unless you cut the pulmonary trunk. Then it divides into left anterior descending coronary artery, as I have shown. I'm talking only about the major branches. Now, left anterior descending, left, it is branched from the left coronary artery. Anterior descending, it lies anteriorly on the sternocostal surface in the interventricular groove. Descending because it goes towards the apex of the heart. What happens thereafter? It enters the posterior part of the interventricular sulcus to anastomose with the dominant coronary artery. Then second large branch is, we called it as circumflex branch of left coronary artery. So left divides into two major branches, left anterior descending and circumflex. Now circumflex enters the posterior part or inferior part of atrioventricular sulcus. From left anterior descending, we can have diagonal branch, and from left circumflex branch, left marginal artery. So like right marginal, we have left marginal. This left marginal is branched from the left circumflex coronary artery. To make this understanding more easier, let us go to the another diagram. Again, in this diagram, you will see this. I have marked this as a node by this red dotted area. In addition to these major branches, we have branches for the SA node from right coronary artery. You can see right coronary artery, a small branch go towards the SA node. This is called SA nodal branch or sinoatrial nodal branch. Usually, it is branched from the right coronary artery. Some say in 60%, some say in 70%. So it is the in majority of cases, SA node is supplied by the right coronary artery. Then there is another branch going towards the infundibulum. Infundibulum is also called conus of the heart. So this branch we called as conus branch. Conus branch comes from both arteries. We have branch from left coronary artery, left anterior descending coronary artery, and branch from the right coronary artery. Here you can see the branch which comes from the right coronary artery and supplies the infundibulum. We call it as conus branch of the right coronary artery. Thereafter, you can see, I told you it is like a crown. It gives descending branches and ascending branches. Ascending branches will go to arteria and descending branches will go to the ventricles. Now you have there, these small branches are branches for the right ventricle. So we call them as ventricular branches. And there are also branches which go towards the atria. We called them as atrial branches. So in addition to SA nodal branch, conus branch, we have there ventricular branches and atrial branches which supply the sternocostal surface of the heart. Then there is the largest branch, what we call as marginal artery. This marginal artery proceeds towards the apex of the heart and supplies apex of the heart. After that, we have their posterior interventricular branch, which is present in the posterior interventricular sulcus. It's also called a posterior descending coronary artery. But before this vessel is given, here an important branch is given which goes to the AV node. So AV node is always supplied by the right coronary artery. Is it clear to you?
Yes,
Is it clear to you?
Yes, sir.
So SA node is supplied either by right or by left coronary artery, mainly by the right coronary artery, whereas AV node is always supplied by the branch from right coronary artery. Now coming to the branch of left coronary artery, initially we have this trunk. This trunk divides into the left anterior descending coronary artery. and circumflex coronary artery. From left anterior descending, we have this diagonal artery, and from the circumflex, we have their left marginal artery. We have also a branch from left anterior descending coronary artery that supplies the infundibulum, and that branch we called it as conus branch from the left coronary artery. So if I ask you what is the blood supply of the infundibulum or conus, it is supplied both by right as well as left coronary arteries through conus branch. Clear to you? Is everything clear to you?
Yes, sir.
Okay.
Yes, sir.
Now I have made a beautiful animation for you to remember so that you can remember the branches and you can also understand. Now in this graphic you will find this vessel represents the aorta. Now what arises from the aorta on the right side? Right coronary artery. It arises from right aortic sinus. From this we have, where is this trunk present? It is present in the atrioventricular groove or sulcus, which lodges the right coronary artery. Now, from this right coronary artery, we have right marginal. Small branch I am going to describe later on. So large branch is right marginal. Then it gives a branch which enters posterior part of AV sulcus. Then it finally gives posterior interventricular artery in case of right dominance. So right coronary artery arises from right aortic sinus. Among its major branches, one is which is present in the AV sulcus. Then this branch gives right marginal artery and it gives posterior interventricular artery. So what are the vessels which are given in between? We have this valvular nodal artery. Nodal is basically the branch which supplies the node. So it is given towards the atria. As I told you, from this we have branches, ascending branches and descending branches. The first branch which is given, we called it as nodal artery, which supplies the node in majority of the cases. Then we have the conus branch or infundibular branch from the right coronary artery. Then we have atrial branches. Towards the atria, small branches are given. We called them as atrial branches. Now, towards the right ventricle, small branches are given. We called them as ventricular branches. So before this posterior interventricular artery is given, we have their AV nodal branch for AV node, which is always supplied by the right coronary artery. And we have atrial and ventricular branches, again, which are present on the inferior surface of the heart. So inferior surface of the right ventricle has got ventricular branches, and for atrium, we have atrial branches. That is why I have kept there AV nodal branch and atrial and ventricular branches. And finally, we get dominant coronary artery. Dominant is defined as a vessel which is present in the posterior interventricular sulcus. In 85% of the cases, it is from the right coronary artery. In 8%, it is from the left coronary artery. And in 7% of the cases, we have branches from right and left coronary arteries, what we call as codominance. We are going to describe it later. So is it clear to you branches of right coronary artery now?
Yes, sir.
Let us go towards the left. From left posterior aortic sinus, we have left coronary artery. Again, it will give branches which will go towards the atria and some branches which will go towards the ventricle. Those ones we call atrial branches, and the ones which go towards the ventricle, we call them as ventricular branches. So first branch, major branch, which is given, we call it as LAD, left anterior descending coronary artery. L stands, it comes from the left. Anterior, it is present on the anterior surface or sternocostal surface of the heart, in which groove? Interventricular groove, anterior interventricular groove, descending because it descends towards the apex. This vessel is important because it's commonly involved in atherosclerosis. Among all vessels of the heart, this vessel is commonly involved in atherosclerosis because atherosclerosis can lead to the clinical consequences like angina and myocardial infarction. So this vessel is very important. From this vessel, we have a small branch, what we call the conus or infundibular branch. As already said, I told you, infundibulum is supplied by both coronary arteries, one coming from the right, another from the left anterior descending coronary artery. Then from this, we also have a diagonal branch. Then there is another branch, what we call a circumflex branch. This circumflex branch gives again a branch which supplies the left margin. In anatomy, we say margin and borders, they are interchangeable. Left border or left margin, it is same. So left marginal is branch from the left circumflex branch. And what happens to the left circumflex branch? That enters in the posterior part of ventricular sulcus to supply again the parts of inferior surface of the left ventricle and also the left atrium. Is it clear to you?
Yes, sir.
Yes, sir.
So coming to the arterial supply of the heart. Heart is supplied by two coronary arteries, which originate from ascending aorta immediately above the aortic valve from aortic sinuses. The coronary arteries and their branches run on the surface of heart, being located inside the subpericardial fibrofatty tissue. That is why I told you in a fresh specimen of the heart, you cannot see these vessels because they are buried in the fibrofatty tissue. Coronary arteries are vasa vasorum, as already said, of ascending aorta. Anatomically, coronary arteries are not end arteries, but functionally they behave like end arteries. Now let us go to this diagram. Now tell me which vessel is this? Which vessel is where I have put the arrow?
Aorta.
Now, which vessel arises from there?
Left coronary artery.
Left
Yeah.
coronary.
You can see left coronary artery. Here we have cut this pulmonary trunk because it lies posterior to it. Then you can see the origin of the left coronary artery. Now see on this vessel. It is not artery, it is basically a trunk. Then this trunk divides into two. Which artery is this? Which artery is this?
Right coronary
Right
artery.
coronary artery.
Very good. Right coronary artery. Where is
Right
it
coronary
present?
artery.
In the anterior part of the right atrioventricular sulcus. Then let us go to the left coronary artery now. Left coronary artery, as shown by this arrow, arises from left aortic sinus, usually larger than the right coronary artery. This term is important because when we talk about the coronary dominance, I will explain its significance. But at this stage, you remember it is larger than this right coronary artery.
Supplies a major part of the heart, including
It supplies the greater part of the left atrium, left ventricle, and interventricular septum. Is supplied by the left coronary artery. Among the conducting system of the heart, so conducting system of the heart, we know it consists of SNOD, we know internodal pathways, then bundle of his right and left bundle branches. The only part supplied by the left coronary artery is left bundle branch. Rest of it is supplied by the right coronary artery. So if I ask you blood supply to the conducting system, remember this exception. Left bundle branch is supplied by the left coronary artery. Rest is supplied by the right coronary artery. Now again, we will go to this. This represents the sternocostal surface as well the inferior surface of the heart in this slide. So which vessel is this? Which vessel is demarcated by this arrow?
Left
Left coronary artery.
Very good. So which branch is this? A small branch going to the infundibulum.
left
Left
conus.
anterior.
Left conus artery.
Left conus branch from left anterior
Coronary
descending.
artery.
Which branch is this? The second branch, that is circumflex branch.
Circumflex.
Okay. Then these are the atrial branches. If we see the posterior surface, this I told you this gives branches both to atria and ventricle on the inferior surface or posterior surface. Posterior surface is basically base of the heart. Inferior surface is diaphragmatic surface of the heart. So after this circumflex branch and circles the left border, it enters the coronary sulcus. It gives branches which supply the left atrium. It also gives branches which supply the inferior surface of the left ventricle. So we have their branches for the left atrium and left ventricle. Now, is it clear to you what are the branches of coronary artery, left coronary artery?
Yes, sir.
Yes, sir.
Now, here is the right coronary artery. It is branches we have already described. We have their conus branch, then these are the ventricular branches, then we have the marginal branch. If we look on the posterior surface, in this case, you will find that a branch is given which enters into the posterior interventricular sulcus. This is the dominant coronary artery. By definition, it is the dominant coronary artery. And here it is branched from the right coronary artery. Now, if you take a section of the heart, what do you see? You can see that which part of the heart is supplied by the left anterior descending coronary artery. You can see here, it supplies anterior wall of the left ventricle. You can see is supplied by the left coronary artery. Anterior part of the septum. In the anterior part of the septum, it supplies anterior 2/3 of the septum. and it also supplies the adjacent part of the right ventricle. You can see in this diagram. So it supplies in the form of letter T. You have their interventricular septum, part of left ventricle, and part of right ventricle, which lies adjacent to the septum. Now here, if we go to the left circumflex branch, this left circumflex branch supplies majority of the left ventricle, wall of the left ventricle. Now if we go to this right coronary artery, you can see it supplies the right ventricle, whole of the right ventricle, and it supplies part of the interventricular septum. Which part? Posterior 1/3. So if we talk about the blood supply of the septum, in case of right dominance, it is anterior 2/3 is supplied by the left anterior descending through its septal branches, and posterior 1/3 is supplied by the posterior descending branch of the right coronary artery. In short, it is supplied by it gets blood supply from both right and left coronary arteries in case of right dominance. Is it clear to you?
Sir, can you please repeat?
In case of right dominance, you can see we will be discussing blood supply of the interventricular septum. You can see this anterior 2/3 of the septum is supplied by this left anterior descending coronary artery through its septal branches. Is it clear to you? Posterior 1/3
Yes,
of the
sir.
septum. Which vessel is present in the posterior interventricular septum in case of right dominance? Posterior interventricular artery is branched from right coronary artery. That gives septal branches. These are basically perforating branches which supply the posterior 1/3 of the septum. Thus, septum is supplied by both coronary arteries. Anterior 2/3 by left coronary artery through it is left anterior descending branch, and posterior 1/3 by it is posterior interventricular artery, which is branched from right coronary artery. It supplies the posterior 1/3 of the septum. So the septum is supplied by both coronary arteries, anterior 2/3 by the LAD and posterior 1/3 by posterior descending coronary artery or posterior interventricular artery. Is it clear to you?
Yes, sir.
Okay. Course of left coronary artery. After rising from ascending aorta, the left coronary artery runs forwards and to the left between the pulmonary trunk and the left auricle. I told you that it is hidden by the pulmonary trunk. You cannot see its origin. Now here you can see there is a cut. We have cut the pulmonary trunk, so only then we can see the origin of the left coronary artery. So it lies posterior to the pulmonary trunk. So on dissection table, if you want to see the origin of the left coronary artery, there are two ways. Either you will cut the pulmonary trunk, that is one, or you do one thing. You go through aorta, give a cut in the aorta and see inside, opening of coronary sinus from which left coronary artery, you can see its origin. But on the surface, you have to cut pulmonary trunk to see the origin of left coronary artery. So after its origin, this trunk then divides into an anterior interventricular and circumflex branch. You can see this is the anterior interventricular branch, and this one is the circumflex branch of left coronary artery. Is it fine?
Yes, sir.
The anterior interventricular artery runs downwards in the anterior interventricular groove to the apex of the heart. So you can see here, it runs towards the apex of the heart, then winds around the inferior border or margin of the heart to enter the posterior interventricular sulcus, where it anastomoses with the posterior interventricular artery. So there is anastomosis between the left anterior descending coronary artery and the dominant coronary artery. In the posterior interventricular sulcus, I have encircled this area. The circumflex artery winds around the left margin of the heart and continues in the left posterior coronary sulcus up to the posterior interventricular groove, where it ends by anastomosing with the right coronary artery. So here we are talking about the right dominance. If left coronary is the dominant coronary artery, then it will give posterior interventricular branch. In case of codominance, in the posterior interventricular sulcus, there will be two branches, two small branches, one from the right coronary artery and another from the left coronary artery. Have you got it?
Branches and distribution of left coronary artery. Anterior interventricular artery, also called left anterior descending coronary artery, supplies the anterior part of interventricular septum In fact, anterior two-thirds of the interventricular septum. It also supplies greater part of the left ventricle and part of the right ventricle. It also supplies a right bundle branch of his, which is present in the moderator band. It also supplies part of left bundle branch of his. Circumflex artery gives left marginal artery that provides the left margin of the left ventricle up to the apex of heart. Diagonal artery may originate directly from the left trunk of the left coronary artery. Conus artery supplies pulmonary conus. Arterial branches, they supply left atrium. The distribution of the left coronary artery. Areas supplied by the left coronary artery are left atrium, left ventricle except the adjoining part of interventricular groove, right ventricle adjacent to the anterior interventricular sulcus, anterior two-thirds of interventricular septum, as a node in 30% of the cases. In 65% of the cases, SA node is supplied by the right coronary artery. But recent studies have confirmed that in very small percent of the cases, SA node receives blood supply both from right and left coronary arteries, thus has dual blood supply. Left anterior descending coronary artery supplies part of the right bundle branch. It also supplies part of the left bundle branch.
Now coming to the right coronary artery, it arises from the right aortic sinus. You can see here. So it lies between. If you want to dissect it at the dissection table, you have to look for this between the right auricle and pulmonary trunk. And left coronary artery lies posterior to the pulmonary trunk, but here it lies between the pulmonary trunk and right auricle. It passes to the right of the pulmonary trunk and runs along the coronary sulcus before branching. Near its origin, the right coronary usually gives off an ascending sinoatrial nodal branch, which supplies the SA node. We have already described it. So it gives this nodal branch, which supplies SA node in majority of the cases. Right marginal artery arises and moves along the right inferior border of the heart towards apex. You can see right marginal artery, which is a large branch. It arises along the near the right border of the heart and moves towards the apex of the heart. The other branches of the right coronary artery are an early arterial branch can be there, which passes in the groove between the right auricle and ascending aorta. So we can have an early arterial branch for the right atrium, the sinoatrial nodal branch, which we have already described for SA node. Right marginal, we have already described it. Atrioventricular nodal, AV nodal branch, which is given by the right coronary artery before giving off final branch. Final branch is posterior interventricular branch in case of right dominans. The posterior interventricular branch, which lies in the posterior interventricular sulcus, is given by the right coronary artery in 85% of the cases. Now, you will have to name these branches. Which branch is this, which is demarcated by this arrow? Is it SA nodal branch?
Yes, sir.
So it is SA nodal branch. Which branch is this?
Conus.
Very good.
Right, right.
Which branch is this?
Atrial.
These
Atrial.
are arterial branches. We don't name them, but these are arterial branches which supply the atria. Which branch is this?
Ventricular.
Yes, not precisely speaking, it is right ventricular branch. Okay. Which branch is this?
Marginal.
Right marginal.
Very good, very good.
Yes, sir, right marginal.
So
Marginal.
marginal is this one. Which branch is this shown by this arrow? Now see, this is the right atrium. You apply your general knowledge, so these are arterial branches for the right atrium. Okay?
Yes,
For
sir.
the base of the heart. So these are arterial branches. Which branch is this? Again, you can say these are the right ventricular branches on the inferior surface of the heart from the right coronary artery. So which branch is given here? An important branch.
AV.
AV nodal branch. Yes. AV nodal branch for the AV node. Then it gives the final branch. What is that?
Posterior interventricular.
Very good. Posterior interventricular branch in case of right dominance. It is also called posterior descending coronary artery. Another important thing is, now this vessel gives perforating branches. Where do they, what structure lies deep to the interventricular grooves? We have interventricular septum. So these from the grooves we have the perforating branches.
Yes, sir.
Really, we have perforating branches from left anterior descending, what we call as septal branches. In the same way, posteriorly we have perforating branches from dominant coronary artery.
Right.
We supply the posterior 1/3 of the septum. Now you understood blood supply of the septum? Because
Yes, sir.
septum lies deeper to these grooves. So anteriorly we have branches which enter the septum from left anterior descending coronary artery. We call them septal branches from left anterior descending coronary. So that supplies anterior 2/3 of the septum. From the posterior aspect, we have interventricular sulcus. Deeper to that lies interventricular septum. So whichever vessel is present in the interventricular sulcus gives posterior septal branches. So posterior 1/3 of the septum, it can have septal branches from right coronary artery, it can have septal branches from left coronary artery, or it can have septal branches from both coronary arteries in case of balanced coronary circulation. Is it clear to you?
Yes, sir.
Distribution of right coronary artery. Right coronary artery supplies SA node, AV node, interarterial septum, a portion of left atrium, the posterior 1/3 of interventricular septum in case of right dominance, a portion of posterior part of the left ventricle adjacent to the septum, whole conducting system of the heart except a part of the right bundle branch, the right atrium and the right ventricle are also supplied by the right coronary artery.
Is it clear to you now? So what is the definition of a dominant coronary artery? There are many definitions. I will go to the simplest one, simplest anatomical definition, and we will ask you the same in the examination. What is a dominant coronary artery? The vessel which is present in the posterior interventricular sulcus is called dominant coronary artery. It can be a branch from the right coronary artery in case of right dominance, from left coronary artery in case of left dominance, or from both coronary arteries in case of codominance. Codominance is also called balanced coronary circulation. Is defined by the vessel which gives rise to the posterior descending artery. Posterior interventricular is also called. You should not get confused with the terminology. Posterior descending coronary artery is also called a posterior interventricular artery. Which supplies the myocardium of the inferior third of the interventricular septum. So simple is the vessel which is present in the posterior interventricular sulcus is called a dominant coronary artery. Most hearts are right dominant. In 80 to 85% of the cases, you will find posterior interventricular is branched from the right coronary artery. In 8% of the cases, it is branched from the left coronary artery, and in 7% of the cases, there are two vessels present in the posterior interventricular sulcus, one from the right, another from the left coronary artery. In this case, posterior 1/3 of the septum is supplied by both coronary arteries. Is it clear to you?
Yes, sir.
Yes, sir.
So let us go to this diagram. What do you see in this diagram? Posterior interventricular on the right side, you will say is given by the right coronary artery. So you label this as right dominance. Here posterior interventricular is given by the left coronary artery. So it is left dominance. Go to the simplified diagram. This is the right dominance. Then below we have the left dominance, posterior interventricular branch from the left coronary. And here we have posterior interventricular branches. There are two vessels, one from the right, another from the left. So we call this type of circulation as codominant circulation. Now, if we go to the area of distribution, what is the area of distribution here? In right dominant circulation, see, anterior 2/3 of the septum is supplied by the left coronary artery, posterior 1/3 is supplied by the right coronary artery. In case of left dominant, what do you see there? Whole of the septum is supplied by the left coronary artery, because here now in both interventricular sulci, anterior and posterior, you have branches from left coronary artery. In the anterior interventricular sulcus, this is branch from left anterior descending coronary artery. In the posterior interventricular sulcus, branches from circumflex branch of the left coronary artery. So whole of the septum is supplied by the which coronary artery? Left coronary artery. Is it clear to you?
Yes, sir.
So in case of codominance, then posterior 1/3 of the septum, as shown in this diagram, will be supplied both by right and left coronary artery. Now, if I ask you which type of circulation, best possible circulation for a human being, and why? So to answer this question, you should know the pathology of coronary artery, atherosclerosis. Let me discuss it. So what will happen if we have right dominant circulation? Here, we'll go to this one, right dominant. Suppose this left coronary artery is blocked, as occurs in atherosclerosis. In case of right dominance, infarct will involve this right ventricle. Anterior 2/3 of septum will be intact, because that is supplied by the left coronary artery. And what will happen to the posterior 1/3 of the septum? It will be affected, because in case of right dominance, it is supplied by the right coronary artery. Now, if we go to this diagram, that is the left dominant. Whole of the septum is supplied by the left coronary artery. God forbid if there is an infarct. In addition to the left ventricle, whole of the septum is affected. Are you getting me? Are you getting me? Am I audible to you?
Yes, sir. Yes, sir.
So if we go to this
Please
balanced
repeat,
coronary
sir.
circulation. So in case of left, before going to balanced coronary circulation, so if left coronary is involved in left dominant circulation, in addition to the left ventricle, parts of the right ventricle, whole of the interventricular septum is affected. So it will have disastrous consequences as compared to the right dominance. So better among the two is right dominant. But if we talk about the codominant, that is the best type of circulation, because here posterior interventricular septum is supplied by the two coronary arteries. So we'll prefer to go for this codominance. It is a better type of circulation if we are taking pathologies into consideration. Now there is a simple diagram. You will have to identify the vessels. Which coronary artery is represented by A?
Fine artery, sir.
So this
Which coronary artery is represented by A?
this is S.
In fact, it is arterial branch, but this is the SA nodal branch of right coronary artery. So which vessels are these? These two small vessels.
Arterial branch.
They are ventricular branches of
Ventricular branches.
right
Right coronary artery.
Which vessel is this? C. C is represented by which vessel?
Right
Right marginal.
Very good. Which vessel is this?
Right.
Posterior descending.
Very good, very good. Which vessel is this? Major trunk. I'm talking about the major trunk. It is left anterior descending. Okay? E is left anterior descending. F is circumflex branch. Okay. Circumflex branch. Okay. We'll go to, I would like to summarize we'll go to the venous drainage of the heart. Now,
हमारा class start हुआ दूसरा.
what? Yes?
The biochemistry class has started.
Yeah. Okay, you can leave then. I have completed. Okay, thank you for watching.
Thank
Thank
you,
you,
sir.
sir.
Okay, thank you. You can watch my video there. You can find everything. Okay, thank you. This was a revision class. Okay, thank you very much.
Thank you, sir.
Thank you for those.